Hello everyone, welcome back to my YouTube channel. Today we will going to discuss in pediatric subject. It is the first unit of pediatric modern concept of childcare. In this unit we will going to study introduction to pediatrics, definition, concept, pediatrics, historical developments of child health, philosophy of childcare, modern concept of childcare, pediatric nursing, culture and religious considerations of childcare, principles of child pediatric nursing. So in that first we will see definition and concept of pediatrics. This is the important part of this unit. Definition: the word pediatric is derived from Greek word means pedia. It means meaning child, and pedia means meaning it's a child. Pedia means child, and itrix means treatment. Itric means treatment, and ix meaning branch of science. Branch of science. Pedia means child, itric means treatment, and ix means branch of science. Pediatric is defined as the branch of medical science that deals with child development and care with the disease of childhood and their treatment. See, pediatric is defined as the branch of medical science. It is defined as the branch of the medical science. This is also a branch of in medical science that deals with the child development, developmenting the child health, child care and all. Child development and care with the disease of childhood and their means disease, their treatment, disease treatment. Next one, pediatric refers to the comprehensive and continued care of children. Here pediatric refers to the comprehensive in the sense curative, promotive and continued care of children. It is a pediatric refers to the comprehensive. This means promotive, curative and continued care of children. It serves both in wellness and illness. Pediatric it also serves in wellness, not only in illness, wellness and illness. Abraham Jacoba, he is known as the father of the pediatric. Abraham Jacob is known as the father of pediatric because his many contribution to this field in the sense pediatrics to child health nursing. He has done many contribution for this pediatrics. Next one, historical development of child health. How does the historics develops in the care of or in the meaning of child health? That in that first one, the historical background of pediatrics is follow as the first citation of quality of breast milk. The historical background of or the pediatric was the quality of the breast milk and child hygiene. These two was in 225 BC in India. These two comes under the 225 BC in India as Sushruta Samhita. Next one, Hippocrates, a Greek philosopher in 370 to 460 BC, also known as father of modern medicine. Next one, the first Indian pediatricians were Kashyapa and Jivaka at 6th century. The first Indian pediatrician means the child doctor or a pediatric specialist. The first Indian pediatrician were Kashyapa and Jivaka at 6th century. They worked on children disease and children care. Charaka was the court physician of Peshwara. He wrote on care and management of newborn. Peshwara, he wrote a care and management of newborn. Newborn in the sense under from birth to 28 days. It's called a newborn. In his Sansthan and Astanga Hridayam. Next one, Araba physician Rajesh 852 923 AD wrote the first book on the disease of children. Wrote the first book on the disease of children. In 1545 AD, Thomas Fair wrote the first book in English on children disease. These all are the a narrator or a scientist or a physicians who were they all wrote how to take care of the child health or how to come over on the child disease. Okay, pediatric as specially came into being in pediatric. This specially came to being in 1860 when Dr. Abraham Jacob established first child clinic in New York and started giving special lecture on disease of children. Next, in 1888 AD, the first department of pediatric was established in Harvard Medical School. 1988, the first department of pediatric was established in the Harvard Medical School. In the 19th century, antenatal care and pediatric care were developed slowly. People started realizing about the children needs. The people have started to realizing about children's needs. The Lady Kelmoford All India League for Mental and Child Health Welfare was established in 1920. In 1923, the first crèche was opened in the India to provide children daycare child care or children. See, these all they may ask for 2 marks or 1 mark. These are not important, but you have to remember the definition. Next, philosophy of child. This is also a very less question mark. Philosophy of family centered care or philosophy of child care. What is family centered care? Okay, family centered care recognize that family is a constant in the child life. So it is not only in this period or that period or according to the age group. This is a constant. Okay, this is the constant period in the child life. Facilitate true parent professional collaboration and not just coordination of service. Here, what does philosophy of child care says? Facilitates the true parent or professional collaboration and not just a coordinating of services. Honor the racial, ethnic, religious, culture and socio-economic diversity of families. Okay. Recognizing the family strength and differing ways of coping. Here what does it do? Recognize the family strength. This child should recognizing the family strength and differing ways of coping. They copy their parents, okay, in different ways. And here the racial or ethnic or religious, cultural, socio-economic, these all family should learn to the children. Next one. Okay, here is an important point. Offer high quality professional service in the form of assessment, treatment and recommendations. Okay. Next, provide comprehensive integracy service that include emotional and financial support for the family as well as educational, therapeutic and medical support for the child. Encourage family to family support and networking. What does this philosophy of child care do? Encourage family to family support and network. Respect the family right to refuse or postpone service offered recommended. Design service that are responsive to family identified productive and needs. And the next one is Modern concept of childcare. What are the concept includes in caring of child in modern compared to the before or in ancient time? Here, from to focus on. Okay, what are the modern concepts adopted in caring of child? See, child-centered care within the family system. Not only in hospital or not only in school, the child care should be start from the in family. Okay, in family, within the family only, the child-centered care should be start begins. Next one. Okay, the taking care of female child as she is future mother. Here should be female child would be first priority, then the male, because she will going to the future mother. So taking special care of female child. Okay, health education and planned parenthood and guarding maternal health before conception. So here before conception, health education on planned parenthood. Okay, planned parenthood and guarding maternal health. It is applicable for the mother who is conception. Comprehensive care of the child from the day of conception throughout the development years of childhood. Okay, from the conception throughout the development of childhood, the comprehensive care should be provided. Holistic care of child, that is family centered. Holistic care is all, every type of or every kind of care should be provided to the child, that is family centered. Here family centered. In family centered, the holistic care of the child will do. Health promotion oriented care. So health not only in illness, before awareing of the illness, the health promotion care should be oriented. Okay, like how to maintain hygiene, how to maintain clean environment, how to taking self care, like that. Health promotion oriented care should be do. Ensure that child must have one parent with him or her in the hospital and having flexible visit hours. So here the modern concept focus on the must him or her with the hospital. One parent should be all the time with that child. Okay, the child must have parent in the hospital having flexible visit hours. Okay, they can visit whenever they want, whenever they available. Okay, warmth and love oriented. The modern concept of childcare says the love and time and warmth should be provided to the child. Okay, next one. Quality care in terms of play, recreation and nutrition, etc. The quality should be provided by the modern concept care in terms of play. Children can play in the hospitality, play, recreation and nutrition. Evidence based practice. Evidence based practice in the sense the nurse should practice everything in the means the caretaking of the child, or in the play therapy, or in the home like environment. Okay, they can teach some educational related oriented programs. The next one, what is pediatric nursing? What is pediatric nursing? This is very, very, very important. Okay, pediatric nursing is the branch of nursing considered with care of infant and children. Pediatric nursing is the branch of nursing. Okay, it is a branch of nursing considered with care of infant and children. It is considered as care of infant and children. It focuses on providing holistic care to infants. It mainly focus on the holistic care of infants, means everything care should be involved in that specialty. Okay, infants, children and adolescents. The goal of pediatric nursing is to foster growth and development of child and promote optimum state of physical, mental and social wellness. The main goal of the pediatric nursing is growth and development. Growth in the sense physically, development in the sense mentally of child, and promote means promotion for it should be goes forward. Okay, promotes optimum state of physical, optimum high level of state of physical, mental and social wellness. The child should be in physical form, mentally and social wellness. Okay. Next one, current concept of pediatric nursing. What are the current concept of pediatric nursing? It can be say as academic. You can remember as a code word as academic. Academic in the sense advocate for child and family. In the nursing, he or she should be advocate for child and family. Like they have to suggest their good and bads. They have to give some suggestion about health, wellness and illness. Okay. Next one, C for communicate for the child. She should communicate with the child as a child. She also should communicate with child in the form of child. Okay. Activate the child activities. So what she should do, activate the child activities. Activate means she should awakening or promoting or encouraging the child activities like play therapies or a recreational, whatever it may be. What does child in specialist in that? Okay. Disseminate information related to child health program. So child health program should be disseminated to the child parents. Okay. Educate the public about child health. So what are the public communicating or information is going on there in the present modern society? They should educate to public. Okay. Motivate people to participate in the child care. Okay. What it does, it motivates the people to participate in the child care. Investigate available resources. So what are the resources are available easily? It should be investigated. Collaborate the care. Okay, collaborating the care. She can give a demos or whatever in the practical form. Okay, next one, trends in pediatric nursing. Okay, what are the trends are going in pediatric nursing? The first one, flexible visiting hours. Flexible visiting hours means the parent can visit a child whenever they want. Okay, flexible visiting hours. If the child is hospitalized or admitted, okay, the parent should get the flexible visiting hours. Okay, next one, rooming in. A parent can rooming in means they can have specialty over in room only, everything. Okay, next, parent support group. The trends of pediatric nursing says the child has a supporting parent group. School teacher involved in care of hospitalized child. Okay, who can means nurse can support or a nurse can give permission to the school teacher to involved in the care of hospital child, because if the child is admitted prolonged time or a long duration, a school teacher can come to that hospital rooming in and they can teach the educated related some knowledges to the hospitalized child. Okay, playing in school and hospital. Play in school and hospital. The child can play in school as well as in a hospital. Care by parents, family centered care. A child can get by care by parents or a family centered care. Then anyone can give the care to the child. Health and nursing team. The health and nursing team should be supported. Evidence-based practice. Evidence-based in the sense the evidence, with evidence-based practices only they can practice. Means the treatment may be or play therapy. Everything should be legally and evidence. Okay, evidence means witness. Prevention of disease and promotion of health. This is the main thing. Prevention of disease and promotion of health. Next, family-centered care. Okay, child-centered environment they can get. High technology care, traumatic care. These all are comes in the trends in pediatric nursing. This part is very very important for 2 marks. Next one is principle of pediatric nursing. Okay, what are the principles should be followed in pediatric nursing? The code word is FEDSIG. Means first one, therapeutic relationship. Second one, family. Second one, family advocacy and caring. Third one, disease prevention and health promotion. Fourth one, health teaching. Fifth one, injury prevention. Then sixth one, support and counseling. Okay. First one, therapeutic relationship in the sense providing high quality nursing care. What it is, therapeutic relationship in the means the main principle of the pediatric is providing high quality nursing care. Next one, pediatric nurse need to have a meaningful relationship with children and their families. She has to be with a meaningful relationship. Okay, not any personal or not any like that. Okay, meaningful relationship with children and families. Okay, explore family strength needs in the effort to increase family involvement. So they are what nurse should do. She has to explore the family strength to involve in the family environment. Okay, in a therapeutic relationship, well defined boundaries separate the nurse from the child and family. Okay, in the therapeutic relationship, well defined boundaries separate the nurse from the child and family. Okay, next one, these boundaries are positive and professional. What should be those form boundaries are professional and positive and promote family control over the child health care. And next one, family advocacy and nursing. What is family advocacy? Ensuring that families are aware of all available health services. The nurse should provide a family as a advocacy or advocate, ensuring that family are aware about all available health sources, like whatever the, if the female child has born, if the male child has born, what are the government facilities they will get, like that. Ensure the all family health services. Okay. Next one, care and encourage change to support existing healthcare practices. Okay, and demonstrate caring, comprehensive, and empathy for others. Next one, concept of a traumatic care, development of therapeutic relationship with parents. Next one, disease prevention and health promotion. Disease prevention and health promotion. In that, every nurse involved in caring for a children must understand the important disease prevention and health promotion. Disease prevention in the sense what treatment can prevent or what mentally support you or mental health can prevent the child disease very quickly. This is important. So that disease prevention and health promotion is very, very important. Next one, health teaching. Health teaching is inseparable for family advocacy and prevention. This is very important, and it depends on the main family environment. Okay, next one, injury prevention. Nurse play an important role in preventing injuries by using developmental approaches to safety counseling for parents of child of all ages. Okay, last one, support and counseling. Attention to emotional needs requires support and sometimes encouraging. Support and counseling. The mentally, physically, a nurse should be supported to the child, or if the families need a mental, emotional status, they can encourage and support. Counseling involves mutual exchange of ideas and opinions that provide basic or mutual problem solving. The counseling may involves the mutual exchange of ideas. Okay, it involves the support teaching technique used to foster the expression of feeling, thought, and approaches to help a family open with stress. Okay, these are the principles of child care. Okay, here the ends with the first chapter, modern concept of child care. If you have any doubt, please drop a comment section or questions. Okay, thank you for watching. In next videos, what chapter or what content you want to discuss with, so you can ask in the comment section. Okay, thank you for watching. Please do subscribe and like for my videos to get more videos. Thank you.